In this video, we'll talk about key points of prostate regarding its examination and investigation. On exam, we are examining the patient which is coming with the poor flow and in the old age. First is abdomen. In abdomen, we have to look for the bladder lump, especially to rule out the chronic retention. Next is meatal stenosis and phimosis. These two things are also the reason of poor flow. That's why it is important to rule out these two possibilities on examination. These two things cannot be diagnosed in any other investigation. That's why it is very important on examination. And the last cause and the rare cause for the poor flow is neurogenic bladder. For neurogenic bladder, we have to examine the perianal sensation, which checks about the spinal segment S2, S3, S4, which also supplies the bladder. In the last, rectal examination. In rectal examination, we have to check the tenderness over the prostate, which signifies about the prostatitis. Always tenderness is for infection, itis. Next, in the rectal examination is induration and nodularity. Both these things signifies for the CA prostate. In the investigation, first investigation comes ultrasound abdomen. In ultrasound abdomen, we have to write like ultrasound abdomen with PVR. This is the first most important thing which usually we miss. If we write only the ultrasound abdomen, then the residual urine will not be checked, and it is very important to check the residual urine. In this ultrasound abdomen with the residual urine, we have to check about the prostate size. Normal is 20 gram. But the size of the prostate is not a criteria to make the diagnosis whether the patient having the symptomatic BPH or not. That is only the symptoms which tells about the BPH, not the prostate size. Second is PVR. This residual urine generally is nil, but in chronic retention it can go up to the more than 500 ml. In ultrasound, this area is bladder. In bladder, there is urine which is seen as black on ultrasound, and this is the prostate area. Next investigation comes the blood urea, which is normal up to 40. Serum creatinine, which is normal up to 1.4. By checking these two investigations, we check about the normal function of the kidneys. Next investigation is urine routine microscopic. Urine routine microscopic examination is important to see whether there is any infection or not. For this, pus cells, normal pus cells in the male is 2 and females normal up to 5. In the last investigation comes the serum PSA. It is last but very important investigation because that signifies for the CA prostate. PSA stands for prostate specific antigen. It is normal up to 4. Another important thing to remember is if we have done rectal examination, then we have to wait for 1 day before getting the PSA done. If patient came with the acute urinary retention and catheterization is done, in that condition we have to wait for 7 days because rectal examination and the catheterization normally increases the PSA value. In prostate, generally we talk about the zones and lobes. In zones, we talk about two zones particularly which are very important. One is transitional, another is peripheral. By the name transitional, you can correlate it with the transitional epithelium. Transitional epithelium is present in the prostatic urethra like this. So transitional zone will be around the urethra like this. This portion will be transitional zone. And why transitional zone is important? Because it causes BPH. Because it is around the urethra, that's why BPH is more symptomatic. It will compress the urethra like this. Next zone comes the peripheral. By name itself, it signifies that it is present in the peripheral area like this. Now you can see that this peripheral zone is very far away from the urethra. Anything present in the peripheral zone will cause symptoms in late stages. Peripheral zone is prone for CA. That's why in CA prostate, the symptoms are late symptoms. Late symptoms. And next comes the lobes. In lobes, important thing is median lobe. This median lobe means present in the median area. This median area comes here. If prostate lobes enlarged like this, then it distorts the internal urethral meatus, and you can see that if something distorts the opening of the bladder, internal urethral meatus, it will cause more symptoms as compared to the lateral lobes. Here you can see that this is the median lobe. This is the median lobe projecting into the bladder. For the poor flow, there are two another diagnosis which are for that investigation is required, like urethral stone. For urethral stone, the investigation of choice is X-ray pelvis, not the X-ray QB, because you can see here in this X-ray that stone is visible here, and if here the stone is visible here, right? And this is the X-ray QB. Now you can imagine if somehow the X-ray is taken only up to this point, then this stone will be missed. So it is important to take the X-ray from here downwards. Like this, we will take the complete urethra. Like you can see here, the urethra is not here only up to this place. It is present here. So X-ray pelvis is more important than X-ray KUB. In ultrasound also, urethral stone will not be picked up. Next comes urethral stricture. For urethral stricture, ultrasound and X-ray pelvis will not be diagnostic. For that, you have to do the contrast study. In contrast study, you have to do retrograde ureterogram. Why ureterogram? Because you are visualizing the urethra. That's why ureterogram. Why retrograde? Because you are pushing the contrast from the external meatus, from this area. Retrograde way, you are putting the contrast. And now you can see that this is the stricture area. Okay. For prostate, you need ultrasound abdomen with residual urine. For urethral stone, you need X-ray pelvis. For urethral stricture, you need retrograde ureterogram. Thank you.